On Friday, May 2nd, the Centers for Disease Control and Prevention and the Indiana State Department of Health conducted a joint press briefing to announce the first confirmed case of Middle East Respiratory Syndrome coronavirus, also known as MERS-CoV, in the United States. The patient with the confirmed case is being treated here at Community Hospital in Munster, Indiana. The patient remains in good condition, and we are maintaining appropriate isolation protocols for the protection of patients and staff. Community Hospital recognized the possibility of the MERS-CoV infection and acted quickly to institute standard protocols to contain the standard and possible spread of the virus. The hospital has been working cooperatively with the CDC and ISDH regarding tracking of exposed healthcare workers. The MERS disease is believed to require close contact for transmission, and the patient's activities in the United States have been very limited. However, in an abundance of caution, the exposed family members and healthcare workers have been monitored daily to watch for the development of any signs or symptoms of MERS-CoV. I am happy to report that all exposed healthcare workers have tested negative for MERS-CoV.
He came on the evening of April 28th and was admitted through the emergency department. He came into a private triage room and then into a private patient care room and was admitted up to a private patient bed on the general medical floor, all within about 3 hours. At no time during this stay were any other patients or visitors at risk because he was in a private setting the entire time. During his stay in the hospital, he was quickly detected by the infectious disease team here as being at risk. We worked with state and federal officials through the State Board of Health as well as through the CDC to send the appropriate samples, and when a positive diagnosis was made, appropriate precautions were taken. Out of safety, because all information is not known about this disease, we made the decision to take all healthcare workers that had been exposed to this patient offline and put them on home isolation and just watch for possibility of symptoms for these people. They're being monitored every day. They're doing quite well, and people are in good spirits. Specifically about the patient, he has been improving every day, as was mentioned. He no longer has any oxygen requirements. He's in good spirits. He's eating well, and we have started the discharge planning process at this point. We expect him to be going home soon.
What we can tell you about this virus mostly comes from the Arabian Peninsula, which is where its home is. And we know that it can spread person to person. However, this happens almost exclusively among very close contacts, either in the home or in the healthcare setting. There is no evidence to date for sustained transmission of this virus in a community. What CDC recommends is that travelers returning from the Arabian Peninsula who develop fever, cough, or other respiratory symptoms within 14 days of arrival report to their health care provider and mention the recent travel to the Arabian Peninsula.
Hoosiers will be glad to know that the collaboration between local, state, and federal health officials in this matter, in my judgment, has been exceptional. And I believe it's played a key role in the efficient and effective response that you hear reported today. But none deserve more credit than the outstanding physicians and staff here at Munster Community Hospital. And I invite you to give them a round of applause. Munster Community Hospital's swift diagnosis, careful precautions, I believe contributed mightily to our public health, and I believe the efforts by the administration, by the physicians, and by the staff here at Munster Community Hospital have made every Hoosier proud.
Having the first case of MERS in the United States right here in Indiana is a scary situation. There's a lot of unknowns, as you'll find out, about this particular virus. As a physician, a father of 5 sons, and grandfather to 6, I understand the concerns and worries of Hoosiers and those here in Munster and other parts of Northwest Indiana. It is a little scary. We enjoy hearing the good news about the patient, but this is still a fluid situation. We will continue to provide you with new information as it becomes available. As Governor Pence says, Indiana is a state that works. To me, this shows that not only are we a state that works, but we work together. we collaborate. The collaboration between national, state, and federal has been outstanding, between CDC, all local health departments, the governor's office, Homeland Security. I want to assure Hoosiers that our medical experts, along with the CDC and hospital, are closely monitoring the situation.